Kids and braces, it's not popular with the kids, nor is it something parents probably relish the idea of paying for. But there are more options than ever for kids and their parents. Here to break them down is Dr. Saba Ahmed with Summit Dental. Good morning to you. Thank you for joining us. And this is the perfect time, isn't it, for children to get braces during the summer months?
Yes, summertime's the best month for children to get braces, just because there's definitely a transition period that they're going to go through, learning about how to take care of their braces. Parents will have the time to come in and talk to the individual placing the braces, either the general dentist or the orthodontist, and they can answer all their questions and just, be ready to go.
What do you think is the best age? Does it go by age or individual patient of when they need braces?
It goes by individual patient. In general, it is definitely better to have braces placed on when the child is still growing, but we definitely do braces on adults as well. And too young, it gets a little bit more difficult because it's a big responsibility to have the braces on. So anywhere between, after age 11, and but definitely the dentist would talk to the patient about that.
What if the child has different problems, like I've heard of a child maybe having an underbite where they need braces even earlier in life? Are there exceptions to them having to get them earlier?
Yes, there's definitely exceptions. The more complicated the case, the earlier is better to start. Again, because, they're growing and it'll be much easier so that you could try to avoid having to do surgery later on in life.
What are some of those options then available for children who are going to get braces?
Well, we have lots of options in braces. For example, at Summit Dental Center, where we do general dentistry and braces, we can do conventional braces, which is the silver brackets and wires.
All the ones we used to have, right?
Oh, yes, the traditional ones. We can do the white braces, which are ceramic, or we can also do Invisalign based on the case.
Now, Invisalign is usually more with adults than children, is that right?
Yes, mostly Invisalign is used more with adults. There is a product that Invisalign makes called Invisalign Teens, but again, you want to definitely just talk to the dentist or the orthodontist about what's best for the child.
And we're looking at video right there. Invisalign is just the snap-in one, so they can take them out to eat.
Yes, they're plastic retainers. They can take them in and out of their mouth. They don't wear them while they're eating, and it corrects the teeth.
Now, you mentioned the white braces, and I'm sure that if Invisalign isn't right or they're not the right age, that might be an option. But does it cost more because of the fact that it matches the teeth more? Is it more work to do?
No, it's not necessarily more work. Actually, on average, Invisalign is a little bit more expensive. So parents do tend to go more with the conventional braces. Yeah.
Anything that you can get through the process faster, because I remember having braces as a kid and I wanted them off my mouth, and I don't care what they look like. If I could have gotten them off sooner, I would have done that. What is the one that seems to work the best?
Conventional braces seems to work the best, and we definitely encourage that for parents. We tell them all of their options and then let the parent decide what's the best for their child.
And we were talking about summertime being really a good time for them to get used to it and everything, but when you first get them, are you going to the dentist quite a bit?
Yes, definitely. They're definitely coming in a lot to talk to the dentist or the orthodontist initially, and then from there they'll be seeing them for their adjustments, and that's why we definitely recommend summertime, just because they can get used to, visiting the orthodontist, and when school comes around, it's just something routine in their schedule.
I think so many people consider the smile to be one of the most important things. They say they look at your eyes and your mouth, but what if someone says, there's just no way I can afford braces, I would love for my child to have them? What are their options in that situation?
Well, we definitely at Summit Dental Center recognize that the smile really brightens up the face, so we will make arrangements. We have payment plans. We do Medicaid orthodontics, and Medicaid does cover braces. CHIP, unfortunately, is a program that does not. If insurances as well, there's a variety of insurances that cover, and of course we cater to our cash patients as well, and we try to make it affordable for them.
Can you say just about how much it would cost for someone to get braces?
On average, if insurance or for a cash patient, it can cost anywhere from $3,500 to about $5,000, again, depending on the complexity of the case.
And then how often are they coming in? Once they get all set, are they coming in once a month to get them tweaked? How does it work?
Yes, initially the kids will start in once a month. They'll see the orthodontist or the dentist even before that, if need be. And then after that, it's about every 6 weeks. So once school year starts, they'll be coming in maybe every 4 to 6 weeks to see their orthodontist.
And can parents just come in and say, you know what, I'm concerned about my child's teeth, I think they need braces, or do they really need to get a dental, you know, talk to their dentist and get a recommendation from them?
We definitely will at our office at Summit Dental Center. We welcome them to come in for a consult, and we'll go from there.
All right. Well, we so appreciate you talking to us today.
Thank you for having me.
If somebody says, I just want a little more information and try to figure out exactly what to do, how I'm going to afford it if my child needs it, can they go somewhere to find out more information?
Definitely. I'd encourage them to visit our website at summitdentalcenter.com, and if they have any questions, to give us a call. We'd be more than glad to meet with them.
All right. And we're certainly happy to put a link to that on our website, myfoxhouston.com. Dr. Ahmed, thank you for coming in today and helping us work it all out. I have little ones, and I know someday I'm probably going to be there, so I'm going to
bring them on in.
Chalk up all this information and make sure I remember.
Thank you very much for having me.
Good to talk to you.
Take care.
Isaiah.